Hi, welcome to Checking In with Amy. My name again is Amy Goldberg. I'm a registered nurse with the Elder Service Plan of the East Boston Neighborhood Health Center. We serve people who are 55 years of age and older who live in our catchment area of East Boston, Chelsea, Revere, Winthrop, and Everett. And the goal of the Elder Service Plan is to keep people living in their home independently, healthy, and in an active manner. Today, we're honored to have our guest to be Dr. Ashley Casey. Welcome, Ashley.
Thank you, Amy. It's nice to be here.
And Dr. Casey is a doctor of pharmacy, and she also is a registered pharmacist. That's a lot of title.
Yeah.
So tell me exactly what you do for the Elder Service Plan.
So right now, I work full-time as a clinical pharmacist and a project manager at the Elder Service Plan. I essentially work with patients and the nursing staff to work on medication compliance. I try to get down the number of medications to a more manageable amount if people are on a lot, which happens quite frequently in the elderly population, and also try to decrease the cost of medications in general because it's also an insurance plan.
Right.
Yeah.
So when I go out and I see patients in their home, what I see is that I'm running around the house and they're running around the house trying to find all the medications that they're on. There's no real way of keeping them straight, and it usually takes a number of minutes. So tell me what systems the Elder Service Plan has and what organizational tips you could offer us today.
So specifically at the Elder Service Plan, we work with the participants to create what's called the Medicine on Time system, and we have an example of that here. And essentially they have, as you can see on your screen in a more close-up, you'll see the packaging is color coordinated. There's morning and evening cards, noon and bedtime. Two on the screen or up there, and you can see they're convenient, they're organized, and they're color-coded. On the next slide, you can see there's your name, the date and time, and the drug. And that way, the packaging is all set every single month for you, and it's home delivered to all of the participants. And it makes it really easy because all you have to do is pop it out. You just follow the date, you follow the time, and you don't have to worry about anything else.
So if someone doesn't belong to the Elder Service Plan, what's a way that they can do it?
You could very easily go down to a local pharmacy, and you can pick up what's called a medication pill box. And you can see there in the medication pill box that they have every single day, so Sunday through Saturday. And typically you'll see once a day or twice a day dosing, but this particular one, and it's readily available, you can buy 4 times a day if you're taking multiple medications throughout the day. So it'll be similar to the Medicine on Time packaging, but you have to set it up yourself or a caregiver needs to set it up for you.
Okay, so those are 2 really good ways of doing it. One with the Elder Service Plan, which we're a little unique with this packaging, and then the second with the medication pill box.
Yeah, so the packaging that we use, Medicine on Time, is available throughout the country at certain pharmacies. Specifically at the Elder Service Plan, though, we, as a part of the program, as a standard, do deliver to the patient's home, and everything's set up in a 28-day cycle, so you never have to worry about calling the pharmacy to pick up your
waiting
meds.
in line.
Or waiting in line or anything. Everything's all just sent right home.
That's great, especially in the bad weather.
Yeah, exactly.
Good weather right now. So now let's talk a little bit about storage. So when you and I met, you asked me, where do I keep my medicines? And I keep them in the kitchen in a cabinet, and the cabinet is pretty close to the stove, but it's convenient for me. So I said, Ashley, what do you think about what I do? And?
So that's not very great, Amy. we had a long conversation about this.
Right.
Yeah, so basically it's not a great idea to keep any medication where there's a heat source, so above the stove is not ideal. If you remember to take your medication, the only way you're going to remember to take it is if it's in your kitchen. We discussed that maybe you have a pantry that's further away from a heat source, away from light, away from moisture. It's really important that you keep the drugs at a stable, controlled room temperature, and that's usually like 68 to 77 degrees, so standard. And some drugs are okay at different temperatures, but you'll see for the most part, when you walk into a pharmacy, it's a pretty stable 72 degrees, and all of the meds are pretty much kept at that when you walk in. So it's important to remember that when you're keeping it in your house, to keep the stability okay for a long period of time.
And so another thing we always thought about was medicine cabinets.
Yes.
So now you would think this is the purpose, to keep your medicines in a medicine cabinet. So your thought?
Yeah, we discussed this a little bit too. It's not an ideal location, again, because of heat and the moisture and the fluctuations in temperature in a shower. And, when someone's opening up their medicine cabinet and they have all the steam in there, and then the heat comes out and the moisture is exposed to the medication. So say you have something like ibuprofen capsules in your medicine cabinet, and it's exposed to these temperature changes and it's exposed to the moisture from the shower. What's going to happen is eventually they all clump together, and then you can't use them anymore.
Right.
So to make drugs last longer, and have a longer shelf life, you want to keep them somewhere, again, that's warm. I mean, that's not warm, sorry. Somewhere that is away from heat, away from light, away from children and pets, to keep it stable and safe.
Well, now everybody's going to have to get rid of their medication
Yeah.
cabinets.
Well, great ideas, like we were saying, if you remember in the kitchen, it's a good idea to keep them away from the stove. But, if you have a pantry that's away
Right.
from those things, it's fine. If you like them upstairs and you're used to them maybe in the bathroom, maybe switch it to your bedroom and you wake up in the morning and it's right in your drawer in your, bedside table. That's
Right.
something that's easy and convenient.
So then the next question is about refrigeration. When I go out to see patients, the most commonly used medicine that might be in the refrigerator is insulin. So sometimes I see insulin in the refrige, they go in to get it, and other times it's on the kitchen table. Then I'm thinking, I hope they're doing things right.
Yeah.
So
Insulin can be one of those confusing situations where you get conflicting messages from different people and doctors and pharmacists. But I made a slide that basically goes over the do's and don'ts. So definitely want to store in the fridge if unopened. So in the pharmacy, to make it last till the expiration date on the box, you want to keep it in the fridge. Once it is open, you can keep it either in the fridge or at room temperature, but you have to make sure that once you open any of the insulins, whether it's a pen or a vial, that you make sure you mark on there the date that you opened it, because then it's only typically, depending on the insulin, it's good for only 14 to 28 days. And if you're not sure which insulin you have and
Right.
how long it's good for, you definitely want to ask your pharmacist, and they'll be able to show you, and it's usually written somewhere on the packaging, but it's small print and hard to find, but definitely make sure you ask the pharmacist, and they'll tell you how long it's stable for outside of the fridge.
And what about freezing?
Yes, you never ever want to freeze your insulin. What can happen when you freeze or you keep it at room temperature for too long? You can actually change the color or the consistency sometimes of the insulin, and it's no longer viable, so you can't use it anymore. And that's something that's really confusing, because a lot of times people will say, oh, well, I'm just going to keep it, you said to keep it cold, and you stick it in the freezer not thinking, and then it gets frozen, and then when it defrosts and melts back down again, it's no longer stable. It's not going to be used anymore.
Right.
So it's definitely good to remember that if you're going on a trip somewhere, that you mark when you took it out of a fridge, and then make sure you toss it after the expiration.
Do you think people do that?
I hope so.
We hope so too. So I know of a number of medicines that are really not taken properly, just from my experience. So the first one that I want to talk to you about is thyroid medicine. So let's talk a little bit about that.
Okay. So some general tips on taking medications as a reminder is you want to remember timing matters. So despite any medication, really, you're going to want to make sure you check with the doctor, check with the pharmacist, and ask, should I take it in the morning? Can I take it at night? With specifically thyroid medications, levothyroxine is one of them. You want to make sure that you're taking that in the morning. And that's usually because it brings up the next question, is to eat or not to eat. A lot of people question, can I eat with this? Can I not eat with this? Or I just drink it with water? And with thyroid medication specifically, you want to make sure that you are not eating with it. You want to make sure it's on an empty stomach. You want to make sure that you're taking it in the morning. So in the morning is typically when you've had an empty stomach already. So when you wake up first thing, you take it, then you go set your coffee off or whatever, you do your errands for a half hour or so, and then you can eat. And that will basically be most efficient in working in your body. So it will prevent unnecessary dose changes and increases. And so it's important to remember that if you take it on an empty stomach every single morning, that it will work better and you'll have the most efficient and lowest dose.
Well, it's something I learned
Yeah.
the hard way. So the next medicine that people are very often on, people that I see, is cholesterol medicines.
Yes.
So your tips on cholesterol medicines?
Yeah, so cholesterol is so widely known. I mean, I know so many people that are on them, even young people nowadays, because it's so prominent to be you're eating your diet as high cholesterol foods and stuff like that. And everyone knows certain foods like eggs are high in cholesterol. But the important thing to remember is that your body actually makes its own cholesterol, and that happens to occur in the evening. So it's really important, as you can see on the screen, to see which medications should be taken in the evening and which ones should be in the morning and the evening. Could be the morning or the evening. So the evening medications include Zocor, Lescol, and Mevacor. So it's important to know that it's going to work best in your body when you're taking it at night when your body is making cholesterol. Studies have shown that that's when it occurs, at night. And so if you're taking your medication then, it will prevent your body from making the cholesterol itself.
See, now, to me, that's extremely important because when doctors or pharmacists said, this is when to take it, they don't explain why to take it at that time. So I think knowing why is like might change your whole attitude about taking it.
I agree.
Properly.
Yeah.
And the next medicine that has all kinds of stipulations is for your bones, and a common name is Fosamax. So tell us about that one.
So this is a very good example of a lot of different factors that go into taking your medication. So alendronate, you want to make sure that, of course, with any medication, why you're taking it, right? So that's something we kind of discussed a little bit earlier. You want to remember that you can use it to strengthen your bones, to treat osteoporosis. So just like you would know simvastatin can be used for cholesterol, you want to make sure that you know that why you're taking the Fosamax. Like you said, why is very important.
Right.
This is another one of those medications that you have to take in the morning. Luckily, you only have to usually take it once a week or once a month, depending on the type of medication that you're taking. Different things for osteoporosis work differently and can be taken at different dosing times. But this one, alendronate specifically, is usually once a week, typically. So you want to make sure you take it in the morning, and usually, mark it down on the calendar. It helps you to remember which day of the week you usually take it. And you want to make sure, again, that's the reason you take it in the morning is because you want to take it on an empty stomach. It does have a lot of drug interactions. It interacts with a lot of foods. So it's important to remember that if you take it in the morning and you wait a half hour at least or to an hour before you eat or take any other medications, that it's going to work the best in your body and you'll get the most out of taking the medication. It's also really important to remember to drink it with a full glass of water. A lot of people don't realize that, especially with this particular medication, it can get stuck in your throat. And this will cause a serious irritation and sometimes a burning. And that is not easy to treat or heal. So it's just important to remember that when you're taking this medication, you want to drink a full glass of water. And then the other point to prevent the irritation in your throat is to remain upright. A lot of people, when they take medication early in the morning, they'll lay back down in bed or something, but it's really important with this particular medication to remain upright to prevent that throat irritation. And the other thing to prevent the throat irritation with this is to not cut, crush, or chew. And that's something that you should always, before cutting or crushing any medication, check with your pharmacist because they'll know best which ones can be cut or crushed. And it's a good point to always double check before doing anything with the physician, with the pharmacist.
That's right.
Yeah.
And then the last medicine that I think is kind of interesting is calcium. And a lot of people age 55 years of age and older are on calcium medicine. And when I go to see them, the bottle is pretty full. And I say, you're not taking your calcium. And they say to me, it's kind of big and I can't swallow it. But they're not telling their doctor or their pharmacist this issue.
Yeah, a lot of times people don't realize that, there are other alternatives. So for instance, if you have trouble swallowing something, certain things can be crushed. So calcium is an example of something that usually can be crushed. And they sell pill crushers in the pharmacy, so you could easily, tell the pharmacist which medication you're on that you're having trouble with, and they can recommend whether you should crush it or not. And so if they do recommend crushing it, that's an option. You can mix it with a little water and then have it that way, or put it in applesauce. A lot of people do that. The other thing is definitely, looking at other options. You might not realize that calcium chewables are available, so you can chew it instead of swallowing it whole. They have actually some, candy flavored ones. There's a lot of different options. Sometimes some things are also available like in liquid form. So if you have trouble taking something, for instance, like Senna is another example that a lot of older people take to regulate their bowels. And Senna is a great example of something that if you have trouble swallowing it, there's available in a liquid form. So it's always just good to check with your pharmacist or your doctor.
Right. And I think people don't realize they have options.
Yeah, there's always other options.
My doctor prescribed this, and that's it.
Yeah, and it also brings back to, just having an open dialogue in general with your doctor or your nurse or your pharmacist, and they'll be able to tailor medications to your needs. So that's something I work on in bringing it back to the cholesterol. If you have trouble remembering to take it at night, and that's when it's going to work best for certain ones, you can take those ones that can be taken in the morning or the evening, like the Lipitor, that you can take in the morning if you have trouble taking in the evening. It's just being open with your doctor, with your pharmacist, and they'll be able to help tailor to your needs.
So what if I took too much?
Okay, yeah, that's something that a lot of people have questions about. If you take too much of any medication, you want to make sure that you call your provider and let them know your medication that you took too much of. I know it happens a lot. Sometimes you forget if you took it, and then you take it again because you didn't realize, and you don't have a system like Medicine on Time where it tells you the date and time, whether or not you took it. So if you take too much, you definitely want to call your provider and have handy the name of the drug, the dose of the drug, and how much you took. If they're not available, or it's night or a weekend, there's a 24-hour hotline, and that's up on the screen, the Poison Helpline, and that's 1-800-222-1222, and they can actually assist you with figuring out, again, having your medication and everything ready, but they can assist you with what to do, whether or not you should go seek emergency help, or whether or not, you might be okay and just wait till you check in with your provider on Monday or something like that. So they can usually guide you pretty well. The Poison Helpline is especially helpful if maybe a child or a pet got into your medication, and they'll guide you as to what to do for them as well.
And then, okay, I took too much, now I know what I'm going to do. What if I forgot to take a dose?
Yeah, so if you forget to take it, it's really important to know that you can take it as soon as you remember it. If it's close to the time of your next dose, you usually want to skip that and then continue with your dosing schedule. So for instance, if it's 5 o'clock, you say, oh my goodness, I completely forgot to take my morning meds, but I have it again, I have a second dose in the evening. It's okay, like for instance, calcium. It's okay to just skip your morning med and then go to your evening. Sometimes the provider, if you call the provider and ask their advice, they might, depending on the medication, just tell you to take 2, and it's okay to take 2. Or in the event of an antibiotic, they might tell you something like, skip the morning dose, continue your dosing schedule, but complete your course to make sure that, okay, you missed that morning dose, you take it that evening, but then you're going to have to extend it that one last dose to the next day beyond what you would have normally done.
And with antibiotics, many times people stop them because they feel better on a Tuesday. And they were supposed to have taken it,
till Thursday.
6 more days or whatever, and they don't do it. So you really have to complete your course. So in general, before we leave, some general tips that you think would be good to leave people with?
I think it's very important to remember in general to always have a list of your medications with you. I mean, if you're on one medication, you're going to remember that, but if anything ever happens and you take extra like you were saying before, or you don't take enough of something, you'll have your list of, it's important to have the drug name on there, the dose on there, and then how many times you're taking a day. And it's important to know why you're taking those medications. So for instance, for my grandparents, I actually made a list of all of their medications with their name, with the dose, with the directions, and then at the very end I put what they're using it for. So if they were taking a calcium pill, you're using it for your bones as a supplement. So I went through all of their medications, and you help them in that way. And I think it's important that you take responsibility and do it for yourself, for your someone you might be caring for. It's really important to take charge and be responsible about your medications. The last thing is definitely knowing your allergies. And on that medication list that you might carry around in your wallet or your purse or something, especially if you're going from doctor to doctor to doctor, you want to make sure throughout the transitions of care that it's easy and everybody knows on the same page what medications you're on, so they don't actually accidentally prescribe something that you might already be on. Right. Or they might need to increase your dose or decrease your dose, and it's important to have that. But on that list, definitely put your allergies and any reactions. So a lot of people, for instance, are allergic to certain antibiotics like Bactrim and Sulfa, and those can have components within the drug that are going to be in other medications. So it's important to know and tell your pharmacist and tell your doctor your allergies in the event that there's some other medications they might want to put you on that might be similar and have similar components, and they want to make sure that you don't have a reaction again.
Right.
And then the last thing is definitely to stay up to date with vaccinations. It's really important, I think, as a nurse, you can agree to advocate to stay up to date with vaccinations all year round.
Right. So thank you so much
Thank
for
you.
coming to visit with us today. And I know that everyone will really come away with a lot of helpful information and go forward with it.
Thank you for having me, Amy.
As Oprah would say, I had many aha moments when we met. We really did.
Yeah.
So thank you again for being my guest. If you are interested in any more information about today's show, please feel free to call at 617-568-6377. You can always email me at checkingin@ebnhc.org, or you can call, write, whatever you would like to do, and receive information from us in our little Checking In with Amy bag. We would be delighted to send you any information from any one of our shows. So again, until we meet, stay well, and I look forward to seeing you again. Bye now.
My parents were always very independent. They always seemed to take care of each other. My dad met my mom when she was 13 and he was 15, so they got a lot of practice. It was really difficult when they were faced with health challenges and started to need some help. It was also really hard on me and my brothers. It seemed like every day we were getting calls. They needed to go to this appointment or that appointment, and it became pretty apparent that they really couldn't live on their own without some help, and more importantly, stay healthy. We're lucky to find the Elder Service Plan. Almost immediately after enrolling, we saw some real change for the positive. All their medical appointments were in the same location, including the prescriptions. If they did need to go to see a specialist, then transportation would take them, and that was a big relief for us. My mom attended the PACE Day Center each day where she could really socialize, and she loved that. When they needed services in the home, that was a big help too. And my dad, he'd still call me every day, but not because he had to, because he wanted to. He'd say, Stevie, you won't believe it, they fixed my teeth. They got me some new shoes today. Just brought some amazing stability to the family. I'll see you a little later today, okay?
Okay.
My name's Lucas Akerley. I'm the activities coordinator for the Elder Service Plan in Winthrop. Today we're doing active parachute games. We have a ball toss with some music. It's fun. Keeping active at ESP is part of our plan to keep you happy, healthy, and independent.
Our mission at the Elder Service Plan is to keep our participants living safely in the community. And we do that in a number of ways, the first being with the physician and the entire team to take care of the person medically. We also try to think creatively and provide other things that they may need, be it shopping service, laundry service. We may provide respite for the caregiver, or even aid visits in our supported housing. We try to be as flexible as possible here in the Elder Service Plan to reach the goal of keeping our participants living safely in the community.
My name is Patty Ferranti, and I'm with the Elder Service Care Program, and I absolutely love it. Just talking about it right now makes me want to cry. Before I was in the SP, I was always calling my family and having them, pick me up to take me to doctor's appointments and stuff like that. And now now that I'm in ESP, I have the door-to-door service, coordinated care. My doctor always knows I'm coming. They always arrange my appointments. Everything is just so perfect. The program is fantastic. It really is.
Any pain when you do that?
As a physical therapist in the Elder Service Plan, a big part of my job is to help people keep up with their strength and balance. A lot of times I see people after they get injured or some type of surgery, but another part of my job is to make sure people stay active with a regular exercise program so they don't lose the strength and balance they gain back.
What we do is we talk to the person to find out what they want. Do they want to increase their endurance, their strength? Do they want to be able to do things easier throughout the course of their day? We will work with them and develop a plan, and we move forward with it.
We try really hard to keep up with the mission of the program, which is to keep people in the community of their choosing for as long as possible and as safe as possible. Even sometimes just a cane or a walker can make all the difference in making sure people stay safe.
Very central to our plan and what we do here is the patient, the person. And the way we deliver that care is by having a care plan which centers around the person's goals, their choices.
As the medical director for the Elder Service Plan for the last 25 years, I've had the pleasure of watching our program grow enormously. While we started out largely in East Boston, we now serve participants in Chelsea, Revere, Everett, East Boston, and Winthrop. I think one of the real great reasons for our success is our ability to comprehensively coordinate our participants' needs. It's not just seeing the doctor or the nurse. Pharmacists, activities directors, nurses, nurse practitioners, van drivers, dietitians, all of us work together under one roof to keep our members healthy, active, and independent.
I love taking care of my mom. It wasn't easy at first. She learned how to better communicate her needs.
And you learned how to not ignore yours.
I discovered how to make healthier meals.
And I discovered how much I enjoyed them.
Becoming a caregiver is a learning experience for everyone. Find articles, tips, and tools from experts and others who have been in your place. The Caregiving Resource Center at aarp.org/caregiving.